Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Liebowitz Social Anxiety Scale assesses the severity of social anxiety disorder symptoms. It evaluates fear and avoidance in various social interactions and performance situations. The scale measures the intensity of anxiety related to social phobia, a major anxiety disorder characterized by excessive fear of social scrutiny. Its main purpose is to quantify the impact of social anxiety on daily functioning. This assessment aids clinicians in diagnosing social anxiety disorder and monitoring treatment outcomes. The scale includes specific items targeting both social fear and avoidance behaviors, facilitating comprehensive clinical evaluation. The Liebowitz Social Anxiety Scale is indicated for patients exhibiting symptoms of social anxiety disorder. It is primarily used in adult populations, including both clinical and research settings. The scale assists clinicians in quantifying the severity of fear and avoidance related to social interaction and performance situations. It is most useful for monitoring treatment progress and for diagnostic evaluation in outpatient mental health services. The tool has demonstrated strong validity and reliability across diverse demographic groups, facilitating tailored treatment planning based on severity assessment. The Liebowitz Social Anxiety Scale consists of 24 items, assessing fear and avoidance in social interaction and performance situations. The clinician instructs the individual to rate each item twice, once for the level of fear experienced and once for the degree of avoidance. Fear is rated on a scale from 0, representing no fear, to 3, representing severe fear. Avoidance uses the same 0 to 3 scale, indicating how often the individual avoids the situation from never to usually. The clinician or patient completes the ratings based on experiences during the past week. Scores are calculated separately for fear and avoidance by summing the corresponding item ratings. The total score ranges from 0 to 144. Interpretation follows established cutoffs. A total score below 30 generally indicates mild or no social anxiety. Scores between 30 and 59 suggest moderate social anxiety. 60 and above typically reflect severe social anxiety. Scores exceeding 78 are often associated with generalized social anxiety disorder. These reference ranges should be considered in the clinical context, alongside other diagnostic information to guide assessment and treatment planning. The sensitivity of the Liebowitz Social Anxiety Scale in detecting social anxiety disorder ranges from 0.8 to 0.9 in various clinical studies. Sensitivity refers to the test's ability to correctly identify individuals who actually have the disorder. Specificity, which measures the ability to correctly exclude individuals without the disorder, varies between 0.7 and 0.85 for this scale. For example, a sensitivity of 0.85 means that 85% of patients with social anxiety disorder are correctly identified by the scale. Conversely, a specificity of 0.8 means that 80% of individuals without the disorder are correctly recognized as not having it. These values indicate that the Liebowitz Social Anxiety Scale is effective in both detecting true positive cases and minimizing false positives in clinical assessments. The Liebowitz Social Anxiety Scale was developed in 1987 by Dr. Michael Liebowitz to provide a standardized measure of social phobia severity. It consists of 44 items assessing fear and avoidance in social interaction and performance situations. Initial validation studies demonstrated strong internal consistency with Cronbach's alpha coefficients exceeding 0.9, indicating high reliability. Test-retest reliability assessed over a 1-week interval yielded coefficients ranging from 0.8 to 0.9, supporting temporal stability. convergent validity was established through significant correlations with other established anxiety measures, such as the Social Phobia and Anxiety Inventory and clinician ratings. Factor analyses conducted by Heimberg and colleagues confirmed a two-factor structure corresponding to social interaction anxiety and performance anxiety, reinforcing the scale's construct validity. Further research has demonstrated sensitivity to treatment effects across cognitive behavioral therapy and pharmacological interventions, highlighting its utility as an outcome measure. Cross-cultural adaptations have also shown consistent psychometric properties in diverse populations, underscoring the scale's broad applicability in both clinical and research settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.